bringing you another set of questions for you to practice. If you are someone who's preparing for a medical coding certificate or someone who's just a medical coding profession, there you go on your screen. This is the question. All right, Mr. Holberger is 62 and has multiple problems. He's in the intensive critical care unit with fluid overload, acute renal failure, and was started on ultrafiltration. He has abnormal chest X-ray, pre-existing type 2 DM, sepsis, and is on a ventilator due to respiratory failure. For the diagnosis only. If you're someone new, I try to help fellow medical coders on medical coding and whatnot. I don't claim anything otherwise. My name is Arshil. Also, leave a like and comment. I can see you have not subscribed to it yet. Anyways, get the answer to this one. It ain't that difficult as you're thinking it is. It's very easy. Try to get the easier parts first. All right, there you go. Answer to this question. Since it is type 2 diabetes, option A and B are eliminated. With these two options, we can see all the codes used are almost similar. So there you go. The answer to this question is option D, the code that starts with A419. All right, moving on to the next question. What is the ICD-10 CM code for reporting MRSA of a known site? If you don't know what is MRSA, it's methicillin resistant Staphylococcus aureus. That's a bacteria that's resistant to methicillin. That is why it is termed as MRSA. The answer to this question for MRSA of a known site is option B. It's B9562 since it's a known site. It's not unknown, it's known site. Moving on to next question. What is the ICD-10 CM code for reporting sepsis due to MRSA? And now you guys know what is MRSA. If you don't, you know, go back to 20 seconds, go behind and see what did I say about MRSA. There you go. This is your question. All right. The answer this question is option C, A4102, as it sepsis due to MRSA. Moving on to next one, which is the proper code or the correct code to the report malignant melanoma of lip. The correct score for this question is C43.0. That is option B. Moving on to the next one. A 56-year-old female presents to the clinic today for a 513 check on a type 2 diabetes mellitus. She states that she checks her blood sugars in the morning, which have all been ranging less than 100. She has not been rechecking after meals, which is the correct ICD 10 cm code. There you go. This should be the easier one. The correct answer to this question, since he doesn't have any complication mentioned here, not even an unspecified or other specified, just no complication at all. That is why the answer is option D, 11.9. Moving on to question 6. The patient has type 1 diabetes with bilateral diabetic cataracts, which is the correct ICD-10 CM code. The answer to this one, since it's a type 1 diabetes, that would mean it's option A or B. Since it's bilateral diabetic cataract, it's option A, E1036. Moving on to the next one, patient presents with an open wound of the left hand. Please suggest the correct code over here. Now choose the best option among the four. Option A as 61402A is the right answer. It's an open wound on the left hand. Moving on to the next one. What is the correct diagnosis code for sarcoidosis with cardiomyopathy? Bit tricky. I hope you don't get this one wrong. It's a bit tricky. The answer to this one is option D, D869. I told you guys this is a bit complicated, a bit tricky one as well. Moving on to the next one, a second last one. If you have not given on this one, if you have not subscribed, I will, you know, tell you to do otherwise. Patient admitted to the hospital for acute renal failure and hemodialysis. Please suggest the correct code. There you go. Should be a quicker one. The answer to this one is option D and 179 with for hemodialysis Z4931. Moving on to the last question. A mother brings a 1-year-old daughter to the dermatologist with a persistent rash on the legs, neck, and arms. The rash has progressed into painful raised arms. She is diagnosed with infantile atopic dermatitis and started on a corticosteroid ointment. There you go. Should be an easier one. And last one for this video. Option D, L209 is the right answer to this one. All right. You know what? Tell me in the comments if you're looking for something in particular. You want me to cover something on medical coding? Let me know. I'm Harshal, and this is Decode Healthcare with Harshal. I'll see you in the next one.